All right, good afternoon, everyone. We'll be getting started here in a few minutes, but I just wanted to say hello and let you know that the webinar will be starting about noon, so we'll be about 5 more minutes. Thank you. Good afternoon. If you're just joining us, we'll be getting started here in a couple of minutes. Thank you.
Kathy, has it been a busy start to your week already with seeing patients and everything else going on, or is it manageable?
Our walk-in visits are down, sick visits starting to drop a little. So we're not completely booking up within 10 minutes as we were.
Yeah. Is that welcome reprieve just with everything that's been going on?
Yeah, we're still not really sitting on lots of open appointments, but we're at least,
Yeah,
filling towards the end of the day rather than, 9:30.
I know we're going to be talking about COVID, but have you seen any flu?
I don't know if the docs are testing for it yet. So not that I've heard, at least.
Yeah, not that. Isn't that great news? If we can just keep that at bay for a little while longer.
Oh, there's Dr. Sullivan. Good afternoon, Dr. Sullivan. Oh, we can't hear you yet, no. Should be a microphone circle there.
How about now?
Yep, now I can hear you. Thank you.
Sometimes when I hook up, it doesn't work. I don't know why.
That's all right.
Great to have you.
We'll be getting started here in just another minute or two.
I'm not used to this platform. I've not done this one before.
Yeah, they're all just enough different to make you question yourself.
Just trying to keep you on your toes there, Dr. Sullivan.
All right, well, it looks like we've hit that noon hour, so we'll go ahead and get started here if everybody's good with that. And welcome to the CPP COVID Vaccination Administration webinar. Thank you for joining us this afternoon. My name is Jenny Kerner, and I am the Vaccine Buying Group Administrator for CPP's Vaccine Buying Group. And so before we get started, I just wanted to cover a couple of introductory items. The first one being that we are recording this webinar, so if you have to step away from your desk at any time, it shouldn't be a problem. We'll be posting the recording of this discussion on our website, which is www.cppdocs.org. That's cppdocs.org in the COVID resources section, so you can view it at another time when it's more convenient for you. And then the second thing is everyone is going to be muted, but this is going to be more of a discussion. And so we would welcome any questions that you have. Please post them to either the Q&A area or the chat, and we will get to as many questions as we can. But this is definitely a webinar designed to answer questions and have a live discussion. So any question or comment is more than welcome. Here is a list of items that we plan to cover today. And so we put together this agenda in anticipation of what we hope to be an expanded age indication for the COVID vaccines to include the 5 to 11-year-olds, which hopefully, if and when that comes in the coming weeks, it will mean that the primary care practice will be even more instrumental in those vaccination efforts, especially for that age group. I think surveys have shown that parents for those age children really trust their primary care provider and are really going to look to them for the effort and for the vaccines themselves. And so we expect a lot of primary care practices really ramping up their participation level in administering COVID vaccines. And so lucky for us, we have a group here locally in the Central Ohio area, Hilliard Pediatrics, that's been doing COVID vaccines in their offices for a few months now. And Kathy Holmick, their office manager for over 4 years, has joined us and is going to share their experience and their knowledge and their learnings so that we can all learn from the experience they've gone through and so that we can get ramped up and feel comfortable embarking down the same route they've gone down. So please join me in welcoming Kathy. Kathy, thank you for joining us today and sharing your expertise. Just a little bit about Hilliard Pediatrics. It is a 5 pediatrician and 1 nurse practitioner size practice with about 7,500 patients. And like I mentioned, it's a suburb of Columbus, Ohio. And so just to give you a little bit of background as far as the size of the group that Kathy's been trying to vaccinate along with her team there at Hilliard Pediatrics and how they got started and things like that. So I think that's where we'll get started, is giving us a little bit of background, Kathy, about how you guys got started, what the process was like for you, and you know, anything you can share about getting started with administering vaccines in the office.
Yeah, so like many of you, when we found out about this at the end of last year, we quickly went on, registered, thought magic, miracle things were going to happen, and then we waited for months. So then we were in contact with our local health department and kind of kept reaching out and saying, you know, yes, we're pediatricians, but we're experts at vaccines, let us help. And then finally at the end of March, we worked out that we were able to get about 500 doses transferred from Franklin County Health Department. At that time it was Moderna because that's all that they had available due to the storage restrictions. So we did several mass vaccine clinics for the community. In a matter of 2 weeks, administered those 500 doses. And then as luck would have it, when the second doses were due, that's when the Ohio AAP was gracious enough to work out that we could get the smaller shipments of Pfizer. And we were able to get our first doses of the Pfizer vaccine around the beginning of May, which made scheduling clinics super fun because I think we did 4 in about a week's time trying to get our second dose Modernas done and start our first dose of Pfizer. Since then, we have probably done 2,500 and 3,000 vaccines combined. And we're fortunate that when the 12-year-olds got approved, that we were able to start vaccinating immediately. Over the summer, we switched away from our big vaccine clinics and started just doing kind of little mini clinics throughout the week as the demand declined, and started administering them at appointments. And then now we're gearing up for when the 5 to 11-year-olds become eligible, having to kind of switch back into mass clinics and then still have the ability to give them at the appointments.
All right, that sounds great. So I think a lot of the questions that we've been hearing from practices really circle around the logistics and the operational side of things. So the ordering, inventorying, storing, and administering. Can you give us some background on what your practice did to not only get trained in those areas, but also, make those things as efficient as possible?
Yeah, so one, and just a reminder, especially for those of you that signed up a year ago that haven't done anything with it, there is that mandatory staff training through the ODH registration portion. We'll call it fortunate enough to have ODH come out and audit us a few months ago. And that was one of the things they asked to see was proof that we had the training logs and that we completed all the training. They checked our fridge, freezer, kind of all the things you guys would expect if you're a VFC provider. So that's what they primarily do. But they want to make sure all of our staff did complete that training. We did not go out and buy an ultra cold storage freezer. We're just using our regular fridge and freezer that we use for our vaccines. So currently, Pfizer can be stored in the freezer, your regular freezer, for 2 weeks, and in the fridge for a month. Just got an email yesterday from ODH about the new 5 to 11-year-old vaccines. The proposal on the table is that those are going to be able to be stored in a regular fridge for 10 weeks because they're going to be a different formulation. So I'm hoping that 10 weeks will maybe then apply to both the 12 and up dose and the 5 to 11 dose. And then inventory, so much of it is like your regular vaccines. The only thing different is they come on dry ice, there's data loggers and those types of things. And then for us, because we're not VFC providers, there was a lot of learning how to interface with the registry and making sure that that is updated. The state does require that that be interfaced and reported within 24 to 48 hours. And like many things, it doesn't always magically go on the first try. So we did have to figure out kind of how to make sure we're going back in and reconciling that.
Okay, great. When you were getting up and running and your nurses or MAs were getting trained on the drawing up of the dose itself, were there any videos that helped you for that process, or was the training enough, or how did that work?
Yeah, so most of it is by and large like most any other vaccine you do. We did have our nurses do that training, which they said was teaching you how to give PATS vaccines, what they do every day. One of the biggest things we learned, and we kind of were ahead of the game on a lot of things, so I felt like many more resources came after we started. But at least for the 12 and up vaccine, Pfizer ships you a 2 milliliter vial of diluent. You are not actually supposed to put the full 2 milliliters in. You're only supposed to draw up 1.8. And they're just so used to most every other vaccine we have, you draw up, they send you the right amount of diluent. You're not really watching how much you're drawing up. So that was really kind of one of the biggest things. And then we also just started storing some in the fridge because trying to thaw for that 15 to 30 minutes on demand just wasn't super realistic. So other than that, they said it really was like any other vaccine you get. You had to be a little more careful because the syringes were a little bigger than we're used to. So if you weren't careful about where you were drawing up your next dose, there was more dripping of vaccine. And just like the little things that we use adult-sized things, you're kind of used to not having to deal with that quite as much. But it was not a sharp learning curve or anything like that.
Okay. Great. I know when we were talking to prepare for this as well, that you mentioned that Nationwide Children's Hospital had some great resources out there, and that also included some of the Pfizer resources. So I've included here on this slide a link to those resources. We've posted them to the COVID resources section of our website. which you can see there in the bottom blue box with the pink writing. So that's the link to the resources. There's a COVID vaccine toolkit for community primary care providers that the hospital has put together, and that includes several different resources, but one of those is here screenshotted on the right, and that's the maximizing the doses of Pfizer-BioNTech COVID-19 vaccine infographic. And so that shows you a step-by-step. I think, Kathy, you even mentioned you posted that at the drawing station, just if anybody needed a refresher while they were going through it and something like that. Is that true?
Yeah, so I don't remember exactly which one we have, but we found it easier just to put a copy there. That way, if it's been a month since you personally had to draw it up, guess what? It's right there, and you don't have to be like, oh, was it 1.8, 1.9?
Yeah.
I don't know that anyone's looked at it in a really long time, but it lives there now. And there are some great resources in there, some of which we've actually used. There's little stickers in there and labels, and I think they did a great job putting together a lot of the things that when we started, we were kind of having to figure out on our own as we went. So it's a great resource, and I definitely recommend checking it out.
Okay, that sounds great. All right, so transitioning to the billing and reimbursement side, what's been your experience with this part of the equation?
Yeah, so like many things, nothing's without hurdles. I would say our patients have been a lot easier to bill for than when we were vaccinating the community. With the community, we had to learn how to bill Medicare. We had to build a lot of new insurances. There was a lot more of uninsured patients, and they didn't love it when a pediatric office was calling them to ask follow-up questions. But that's what any new thing you do, and we chose to vaccinate the community, and we knew that that was a learning curve. The biggest things we learned, the uninsured fund is fantastic. You technically have to ask them for their driver's license number or their social security number. You will encounter people that don't have either or just decline to provide it, and that's okay. You can still bill the uninsured fund. You just have to attest that you actually asked them for it and they declined to provide it. And of course, we learned that after our first big clinic, so then we had to try to catch those people the second time. There are different, I'm sure as you guys have heard, different admin fees based on whether it's Pfizer or Moderna. I suspect because of how different the 5 to 11 vaccine is going to be, there's going to be yet another set of admin fees for that. So for Pfizer, you have the 0001A for first dose, 2A second, 3A for third dose. Our practice and the state of Ohio does allow you to bill a penny placeholder for the actual vaccine itself, which for Pfizer is that 91300. Our practice chose to do that just from a tracking standpoint, and that way we could kind of justify what the admin fee was for, which on the payment side adds a little bit of work, but it's a lot easier for us to make sure that we're not missing those admin fees. And then we learned now that you're allowed to co-administer vaccines, if you give, say, Pfizer or the COVID vaccine and a flu vaccine at the same appointment, insurance doesn't like the two different administration fees. And so they were paying our COVID vaccine fee and then denying all of the other vaccine admin fees. So by trial and error, we added a 59 modifier to the 90460, 90461s, and that allowed them both to be paid. Still have not actually found that in writing anywhere that that's what they want to do, but that seemed to be the solution to saying, no, there are two different administration fees, please pay both.
Okay. Yeah, I don't know. I know, again, we were talking earlier about some helpful resources. So I know the AAP has a whole page on all the things you mentioned, like billing Medicare, Medicare versus Medicare Advantage, and underinsured and the uninsured fund, you know, so they have a whole page, and that's here. Again, we have it in our resources section, the COVID resources section, a link to that AAP summary there, and they also have all the codes like you mentioned too for the dose, but as well as for the administration. So they've summarized it real well there. How about any patient incentive programs that you know about? Do you make your patients aware of those, or do you promote those in any way?
We don't. We, you know, to be honest, we want people to buy in for the science behind it. Plus, I find most kids aren't magically going to get the vaccine for their 1 in a million odds of maybe getting a scholarship that they may or may not have been eligible for anyways. So I haven't found any. I didn't think when the first scholarships were announced that we even got more than 1 or 2 phone calls as a result of all of that, and those could have even been luck of the draw. Like, it didn't even seem like that did it. But we want them to buy in for evidence-based reasons behind it, and most people we haven't found much success that is going to convince them magically to get on board with getting the vaccine.
Okay, great. And I know your practice doesn't see Medicaid patients, but the state of Ohio did announce an incentive program for Medicaid patients. Those who get their vaccine between August, which has passed, but before December 31st of this year, will get a $100 incentive, and it's all a partnership of all the managed Medicaid plans there listed. And all the details are there as well. So, so that document is out there as well. If those of you who participate in the Medicaid programs can promote that with your patients, that might be helpful as well too. At least during the scheduling process or the recall process, you know, I think that might be an extra incentive for some of those practices. Okay, great. How about lessons learned? I know that there was probably a lot. As you said, you guys were one of the first to go through the process. And so I'm sure as you went through it, not only did you guys learn, but also everyone else was learning, and these more of these resources were being developed and things like that. But can you give us a little bit of a summary on things that you learned through the process?
Yeah, I felt like we learned everything the hard way. Like, we would learn everything like the week after it would have been helpful. Most things, I think now the resources are out there. You don't have to figure things out for the first time. And I suspect most of you aren't going to be looking to vaccinate the broader community. So you don't have to learn how to bill Medicare and how to set up with that. Most of it was just sitting down and working through the process. You're going to have I would love to say they're just like flu clinics, just a different vaccine. And unfortunately, we have not found that to be the case, but you kind of learn what works for your practice. Our practice didn't want to do the drive-through clinics. We just felt there were too many variables that we didn't like for that. And we've learned how to adapt it to our practice. And I think everyone's going to figure out what that looks like for them, depending on how they're used to doing their clinics.
So can you expand a little bit about that? Like, so you said that you thought about doing drive-through clinics for the COVID vaccinations, but too many variables, like the 15-minute wait time, or what else did you take into consideration when deciding that?
Yeah, so we more looked at the drive-through clinics, to be honest, last year when we were trying to figure out how to do flu clinics given COVID era. And our staff wasn't super keen on the thought of climbing into cars and making sure cars are going where you want them in our parking lot. We do actually have a loop around the building, but it's not super wide. And it's not like we could easily get 2 lanes of cars through, and just trying to figure out logistics of where to store. And we just decided, you know what, we think we can do this inside just as safely, and that's where we're comfortable. And so we made a lot of modifications last year with everything was pre-scheduled. They'll come in this door. We had them leave a side door, and it worked great. And our patients actually loved it and told us never to go back to walk-in flu clinics. So we felt, let's stick with what we know and let's do the COVID vaccines the same way. 15 minutes though was super fun challenge. With flu clinics, you just fly, the kids fly in, fly out, they're done. With COVID, you have to have them wait that 15 minutes. So that was a logistical issue for us. And so we did decide, it wasn't probably a favorite decision, we decided to have them wait in the car, and we had a physician that was staffed for the parking lot. So for the entire couple hours of our clinic, they would socialize truthfully in the parking lot. Some days it was nice and beautiful, other days it looked miserable. But they were out there with the EpiPen in their pocket, their emergency kit there, never had to use it. We gave all of the parents, or all the patients, I guess at the time, a little slip that said, thank you for coming. Please make sure you're waiting the 15 minutes. If you experience any of these symptoms, please honk your horn. If for whatever reason the physician that's in the parking lot doesn't hear you, please call our office, listed the number, and said, please do not let them put you on hold. Please tell them what's going on. I think we had one person ask about a rash, and there really wasn't, we haven't thankfully had any issues with it. So mostly the physicians socialized and chatted and made friends.
That's good. That can't hurt, right?
Yeah.
So you mentioned a little bit about how the COVID vaccination clinics differ from the flu clinics. Is that the biggest difference? Is that when you said like the flu clinics, they can just go ahead and then the COVID clinics, like they'd have to wait, or are there other like more from like the prep side that you have to take into consideration, like the dose prep side or anything like that?
Yeah, so definitely when we were leaving them frozen, it was just harder to plan pulling them out, making sure they're thawed. We also have switched to single dose flu vaccines. So having to draw them up, plan for how many kids or how many people are coming. The other biggest thing is they're just not as fast. So when we did the big clinics, there's all those screening questions. And especially when they were the older patients, not all those answers were magically no, like you're used to with your flu screening questions.
Yeah.
And some are, have you had COVID? Well, you're going to get a decent portion of patients that have had that, and then you have to ask questions about that. And so we, for the big clinics, would have them come in, check in, see if they completed the screening questions ahead of time. If not, give them the form. They would go to a set of tables that we had that were staffed with a nurse or a physician. They would review the screening questions with them, make sure they're eligible for the dose, make sure there's no contraindications. And then assuming all of that was fine, say there was something like they were on blood thinners, we would highlight that for the nurse in the back. They would take their screening form with them, and then they would go to the back and administer it. Even with doing that, we found we were still only about half as efficient as with a flu vaccine. It just came with more questions. You had more people asking about the side effects and telling you the story about, well, I heard my friend had this. Do you think, you know? And even now that there are more our patients, it's just more questions. It's not the annual flu vaccine that's easy peasy in and out. The kid gets there, you know, and it's done. So like I said, we're about half as efficient, and then just the paperwork of it.
Okay. I think you mentioned this earlier, but I just wanted to make sure everyone understood the steps you went through to decide between if you would do COVID vaccinations at the same time as flu vaccinations. Now, I know the flu is probably happening right now, and we're anticipating more COVID vaccinations coming up if and when the age gets expanded. But do you expect, like in the November timeframe, to be co-administering those vaccines, or do you expect to keep those pretty much separate?
So we're actually co-administering them now. So we basically took 2 flu spots away from what our normal numbers would be per 15 minutes and added a COVID vaccine spot. For now, that's enough. We're not filling those, or if they're filling a couple of days out, and it's no big deal to have the kid come to the next clinic. We anticipate that will shift drastically, and fingers crossed it's going to be enough into flu vaccine season that our flu demand will be really low, and those slots will mostly be open, and we'll add a few flus for our second dose kids just turning 6 months, and then we can primarily do the COVID vaccines. We like color coordinated simple things, so our flu sheets are one color, our flu mist are another color, and our COVID vaccine sheets are yet another color. So there's kind of a visual. And then luckily the syringes and everything looks so different that we didn't think there was going to be a high risk of issues of getting the wrong thing. We basically just said these 6 rooms are flu. We'll tuck our COVID patients in this set of rooms since they do have to wait the 15 minutes. And then since there's only a handful of COVIDs, we are having them wait in the exam room. We just have them spread out enough that we have space for that. Once we go back to mass clinics of COVID, we will have to switch back probably to a physician in the parking lot.
Okay. So do you think leading up to what we hope again is a busy COVID vaccination grouping with that age indication expansion, do you feel like most of your patients will have already gotten their flu vaccine in that age group, and so there wouldn't necessarily be a lot of opportunity to give the same patient both vaccines?
Hopefully. We've definitely scheduled some kids that are getting both now for the COVID vaccine, and that's simple because they already have all their flu stuff ready. So we kind of treat them like COVID that's getting a flu rather than a flu that added a COVID.
Gotcha.
We're flexible and able to flex either way.
Either way, okay.
Someone came that day and said they wanted the COVID vaccine and we had the time to do it, we would say, sure, no problem.
Yeah, gotcha. Okay. Well, that's great. And so I know for the last few months you've been doing COVID vaccinations along with the routine visits when someone asks or when the provider, identifies an opportunity. So what operational concerns or considerations did you take into, did you think through in order to implement that in the office? And I know you shared some resources with us here.
Yes.
I'm assuming those are for those.
Yeah. So the biggest difference for us initially was just tracking the inventory. We track all of our inventory well, but with COVID, there's a lot more accountability for that and making sure it's all tracked real time. So when it was at the big vaccine clinics, okay, there were 200 people scheduled, 198 showed up. We know we should have used this many vaccines and we should have this much left. That was easy. When it's at appointments, there is no, hey, look, I got a COVID vaccine, because it could be at a well visit, it could be a sick appointment, it could be I was here with my child and a parent asked to get it. So the log there on top is what we kind of created to help make sure we're not missing any doses, because as much as I would love to say it never happens, I'm sure occasionally we give a flu vaccine throughout the year that doesn't magically get documented for a sibling or something like that. And it's flu that no parent usually screams and wants proof that that magically happened. Well, with COVID, everyone wants proof, everyone needs it documented. So we want to make sure we were doing absolutely everything we could to track all this. So when the nurse opens the vial for the day, they put the date, the lot number, and then every dose that's given, they just put their initials on it. And every morning I go, everybody has a form that they fill out. We decided appointment, non-appointment, everyone's doing the screening form. That way we have the documented consent with the wonderful legal language about it's emergency use only. I look to see if there's any forms, look to see if any vaccines were given. And that helps me look to see if I need to reconcile our inventory in Impaxis. And then the bottom log there is what I'm using to reconcile that. I magically decided to take a week vacation this summer, so someone else had to fill in. So we kind of worked together on how that made sense to make sure that everything was matching. So we basically go in, make sure that what it started with, we account for doses wasted if we got that 7th dose, and then we make sure we adjust it both in our EMR, which is eClinicalWorks, and in Impaxis, which the actual adjustment happens in the VOMS portion of that. And then if there were any notes such as 2 lots used, but 1 clinic, or anything weird like that, that we would want to make note of. And that helped us manage how to keep track of things that you couldn't just look at the schedule and say, oh, I should have given 5 of these today, because it wasn't that simple.
Okay, and you mentioned a little bit about wastage. So I know that's been a big topic of consideration when people are looking at implementing it, and in some cases having to order more doses than they're comfortable with. So how have you guys taken steps to mitigate the wastage, and what have you done about that?
Yeah, so in the beginning, we scheduled exactly the right numbers we should get. We had waiting lists, and if we drew up an extra dose, we would call people off the waiting list. And then I kid you not, it was like hot potato of who would actually throw away the extra dosage when we couldn't fill it, because nobody wanted to do it. It was all like, no, you get rid of it, I can't. Now it's not the case. The state has made it very clear. Maximize vaccination opportunity over wastage. So when we do our clinics, we do still schedule in batches of 6, but if 3 sign up, great, that's 3 kids that got vaccinated. We're not going to tell them they can't come in because we didn't get 6. I kid you not, this happened last week. 5:01, a patient said they wanted the COVID vaccine, so we opened a vial at 5:01 on a Friday, I think. We knew we were throwing away 5 doses, but that was still a kid that wanted to get vaccinated, that we took advantage of the opportunity. So yeah, now there's a lot less zero in the wasted and a lot less extra doses, and a lot more high numbers, but we are finding that there are still those kids that aren't going to go out of their way to get it, and we want to do everything we can to get as many kids vaccinated as possible.
Okay, that's great. And then I think you shared one other resource with us here, if you want to describe it, but I also want to point out to everybody that the link to find this form is down here at the bottom. It's on the Ohio Department of Health website. But if you want to go ahead and explain how you use this and how it was helpful for your practice, that'd be great.
Yeah, so in the beginning, we were just trying to figure out the best way to get the information. So we took this form that is available from ODH. I shared their version of it, and we modified it to our practice. So we kind of, most of the top section is identical. We can't change the screening questions. We can't change what information we want to collect and make sure we have. But we changed the consent language a little bit to make sure it's parent friendly and doesn't just imply that you're the one consenting, and we put our practice name in there. And then at the bottom, we took out stuff that we didn't care for because we didn't need some of those sections, and kids tend to sometimes not always just get their vaccines in their arms. And so we just modified it to fit our practice's needs. And then that's the form that the parents fill out, or the patient, and that gets scanned into their chart. But we decided it's, especially since it's emergency use, it's not full FDA approved. I know for the older people it is, but it's still not for 12 to 15. We just felt better having the signed consent. So there were 0 questions that could be brought up later that we didn't try to get that consent, and that they weren't aware that it wasn't fully approved.
Okay. Great. And we do have another question here from one of the audience members. How did you handle the 15-minute wait time? Did they wait in the waiting room, exam room, or other?
So if it's at an appointment, they just waited in their exam room. If for whatever reason we needed it, I think occasionally we would have a few wait in the waiting room, kind of like we did pre-COVID when we had an HPV vaccine or something like that. Our waiting room still has a couple of chairs in it that are back against the wall away from where patients are checking in. But then for the mass vaccine clinics, we did have them wait in their car.
Okay, great. All right, I'm just scrolling through the questions here. It sounds like another attendee said that the Medicaid incentive has been huge for their patients and their parents. So, so they encourage everyone to include that information when they're reaching out to their patient population as well, if they have that patient population. And that looks like it, unless there's any other questions, please chime in now. That's pretty much what we had for the discussion part, and then we'll get into a little bit about the CPP resources and discount opportunities, but I want to give everyone a second here. Here's a question from Dr. Sullivan. Is there anything similar to a VIS sheet that you give them?
Yeah, so you're technically required, just like the VIS, to give them, it's the patient fact sheet for Pfizer. I still haven't seen, honestly, for the older population, they actually have created a VIS, even though it is now FDA approved. Like the VIS, you don't have to give them all a paper copy. I'm gonna see if I can actually do this and not completely ignore the signs that are messed up a little bit. I don't know if you can see that, but we put in all of our exam rooms a sign on the back of the door that basically has a QR code that links to our website that has all the information about the vaccine, and it also has that patient fact sheet on there. It also has where they can sign up for the VSafe app to report any signs and symptoms. And we found that was a lot easier because, I'll be honest, most parents have zero desire to take I believe it's a 4 or 8 page packet home with them that they're never going to read. So this way we tell them you can use that code. It's on our website. You can also just go to our website if you can't remember. And that's much more realistic for them to actually recall where that resource is. And then we do still have some printed in the event that somebody wants it, but I think we have almost all of those copies still.
That sounds good.
Hey, Jenny, I have a quick question.
Sure.
Kathy, I know, the offices have been really busy, so getting staff buy-in to really think through all of these things that are going on and administering to patients and in your case, families as well. I'm just interested, when you first started, how did you get the team kind of really coalesced around this and feeling like this was the right thing to do? It's just, I'm just interested.
Yeah, so oddly, when we first started, they were excited and on board. We've never forced our staff to do our flu vaccine clinics. We've just always had enough staff to volunteer to work them. And people that have never picked up any extra opportunities were magically signing up. Oddly, they didn't have the same compassion for our flu clinics again this year, and this became a little difficult to staff. So we've had to make some adjustments there, but I think that's become progressively an issue, not because of the COVID vaccines. I also think part of me thinks that they knew this, we were going to ask them to do more COVID vaccine clinics again soon, but they seem way more excited to give COVID vaccines than they seem to be to give flu vaccines, because they want life to return to normal. We want to do anything and everything we can. I already had somebody ask me, hey, do you know when we're going to get approval? I already have at least like 20 kids that I want to sign up for when we do the clinic. And like, are we doing others? Because I can get you at least another 20 more of just friends.
Same with the physicians. Did the physicians feel really, just putting all of this together, and then of course now adding on flu, it sounds like they were pretty involved even at the level of managing the parking lot and that kind of thing. So I'm just interested to hear how they looked at this as well.
Yeah, much more excited day one than by the end of the clinics, when schedules got a little more busy, but we've already had the discussion about, okay, so what if our staff is completely burned out and we don't have volunteers to staff the COVID clinics? What are we going to do? And they are such strong believers of it that despite the fact that none of them have given a vaccine probably since residency or before, they have volunteered themselves to get re-educated on that and be the ones to vaccinate or do what they need to do, because at the end of the day, this is a cause that we support and are huge proponents of, and the community kind of knows that we've had this stance, and we want to make sure that our younger patients get the same opportunity that we've given to others to get vaccinated here if they want.
Thanks, Kathy.
All right, thank you, Frank. Any other questions from anybody?
I will say while we're reading, one of the things I forgot to mention in the billing section, we decided to set our different doses, so first dose, second dose, third dose fee schedules to just be slightly different. So like if you were charging $1 million, our first dose was $1.1 million, our second dose was $1.2 million, our third dose $1.3 million. Don't freak out, Frank, we're not really charging $1 million. But that helped us have a visual to say, okay, I know this was scheduled as a second dose. Did I get the right CPT code on there? Because they're all going to get those admin fees with the right dose, the right manufacturer. It's error prone to make sure you do that. And if you don't get it correct, if you bill a second dose and it should have been a first, they'll deny your second dose or vice versa. So that was just our visual way to help when we're rapidly running through those claims, just have another quick double check to make sure we're billing those correct.
That sounds like a great tip. Yeah, that makes a lot of sense. Thank you for sharing that. All right, I don't think we have any other questions. Anything else, Kathy, that you thought of that you want to share, or?
I don't think I actually mentioned the ordering. We can now order weekly. For pediatric practices, you can order the 12 and up doses in increments as little as 30, and you can order weekly. And then they just had an email last night preparing for the 5 to 11-year-olds because they love to make our life complicated. They are going to be a different vial that is ordered differently, that is stored differently, to keep life fun and interesting. But those right now, they're allowing you to order up until tomorrow at noon. You can pre-order for the 5 to 11-year-olds. The minimum order though is 300 doses. I still don't know exactly how many doses are going to be in a vial, but it looks like the order quantities are 300. The good news is, like I said, they are, at least what is being proposed is that those can store in the fridge for 10 weeks instead of a month. So you're going to get a lot longer storage time on that. And then our interpretation was go ahead and ask for the 300, because if something happens and they don't get approved, that's not on us if they let us pre-order. So we want to have them and be ready to go when it gets approved.
Well, that's great to know. Thank you. All right, well, we'll go through quickly, and if anybody has any more questions, please feel free to insert them in the chat or the Q&A function. Just to review quickly a couple of resources that CPP has for CPP members. And the first one is we have reached out to a group called K2 Scientific that specializes in vaccine refrigeration and freezers. And they actually have an ultra low freezer that's been recommended from another member practice. It's a 5 cubic foot ultra low. The model number is there, the K205ULT. Nothing special from an electrical standpoint, but you may need to consult with either the manufacturer or an electrician just to make sure you have a good setup for it. It requires a dedicated 20 amp circuit. So if you don't have that, it might take time to get that worked out, with an electrician within your practice. For this model specifically, they can ship anywhere in the US with white glove delivery available in over 90% of the zip codes. And what white glove delivery means for them is that the FedEx driver will bring it to the spot where it needs to be within your practice and unpack it and do everything else. It is already preset, so there's no setup necessary. You basically just plug it in and it's already set at the temperature that it needs to be. The list price for this unit is $4,795. There's a CPP member discount of 14% off that you can enter in at checkout. And there's the discount code there. It's USPEDS 2021. And if you have any questions or run into any issues, there's our contact name and contact email for our K2 representative. And so hopefully that would be helpful. I know, Kathy, you mentioned that you guys didn't feel like it would be necessary for your practice, especially now, if there's a 10-week refrigeration time with the 5 to 11-year-old doses. But just wanted to make sure this was available for members who did see a need for this in their practice or even long term. They did say that inventory is good right now, but as you all know, every headline every day is talking about supply chain issues, and it's a very volatile supply chain in this area. And so if you are thinking this might be needed for your practice, it might be better to look into this sooner rather than later. The next item that we have a discount on is LogTag temperature recorders, data recorders. And so all of the original LogTag equipment that have been approved for VFC use, and we've had a discount on for our members prior to this, all of those models have been adapted to accommodate the ultra low temperatures. And they're currently in stock through a distributor named Global Sensors. And so I have a link to their LogTag equipment link there where it's globalsensors.com vaccine monitoring resources. And members who order through the Global Sensors website will get 15% off by using the discount code CPP15. And the price for these units range between $72 and $249, depending on what features you want. Like I know one of the models connects to Wi-Fi, so you can download those temperature logs easily and things like that. So, there's I think 4 different models that you can choose from there. And then just a reminder for our members that we do have a vaccine storage equipment grant. So if you're buying refrigerators, freezers, temperature monitoring equipment, anything like that, we have a grant up to $750 per practice to help offset the cost of that. Now it is tiered, so if you're getting just a data logger, that's $250. Our lowest tier is $250, so you'd essentially get that for free. But then if you get something more expensive like the freezer, that's $4,700, you would get the full $750 grant to help offset the cost of that, in addition to the 14% off that our members get. So if you have questions about this program or would like more information or an application, just contact us at CPP, which is cpp@nationwidechildrens.org. And we also have more information on our website under the savings and benefits section. There's a whole section on grants and grant programs. And then finally, we don't have a discount on this, but we heard it recommended from other practices, and we just thought it was a great low-cost way to market your practice. These are COVID vaccination card holders. You can put your logo on them, your contact information. we thought it would be a great resource, not only for our member practices to give to their patients to keep the card safe so that when they come back for their second dose, they have it there and they're ready to go, but also just to really, put your name out there and have your contact information in front of your patients at all times. And I think it would just be a great service for your patients. And so this card is just one example that we found. It's through qualitylogoproducts.com. You can see the price breakdown here based on the quantity. And like I said, I think it's a pretty inexpensive way to market your practice and really take care of your patients and make sure that those vaccine cards stay intact, at least until the second dose. All right, I think that's it. Any more questions that came in? I don't know. I don't see any more. Just wanted to make sure. Okay, I think that's it. Kathy, any other last parting words or comments?
I think in the beginning, it seems a lot more scary than it really is, especially now with the state not making you feel terrified about wasting a dose. A lot of the hurdles really have been removed. I suspect they'll lower the amount that you can order. And if you're scared about the 300, you can transfer them to another practice. The state will help you transfer them if you're not going to be able to use them. So there are still ways to make it work. I would love everyone to vaccinate everybody, and then our staff doesn't have to do it all. But yeah, I mean, it really isn't as scary as it all seemed at the beginning.
I just wanted to mention, Kathy, we just really appreciate your expertise and being willing to share with the rest of the group. We're all kind of in this together, learning, better understanding. And as you say, when you're first starting out, there's a lot of fear around some of these things, especially wastage and staffing and all of those things. And it seems like you just work through it as we all do, one thing at a time, right? So it's great that you shared all of this. And Jenny, I was wondering if you might mention, I know you brought up the vaccine equipment grant program, and I know that, a lot of our members have taken advantage of that, and there typically has been a 5-year kind of restriction, if you will, if you want to apply for another grant down the road. And I know we've done some interesting things with this just because we know this is a really challenging time to kind of alleviate that restriction. But can you talk a little bit about that?
Yeah, typically the maximum in the program is a $750 grant, and each practice would be eligible for that every 5 years. So if you're finding yourself having to purchase another refrigerator down the road or something like that, you can apply again. However, due to COVID and extreme circumstances we all find ourselves in, purchasing new equipment, trying to make it work, we're waiving that 5-year window. So if you've already gotten a grant in the last 5 years, you can still get another grant because we want to encourage everyone to store these vaccines safely, and we know that it's a new process as well as a financial burden on practices to get that equipment into the practice, and so we recognize that and want to help where we can.
Great, thank you.
All right, well, thanks again, Kathy, for sharing your expertise, and thank you all for joining us during your lunch break. We appreciate it, and if you have anything else, please send us a note, and we can always follow up by email and just tap Kathy on the side and ask her for some answers if we need to. But no, thank you, and good luck, and please let us know if there's anything else we at CPP can do to help with these vaccination efforts, because that's really what we were created to do, is help make the lives of our member practices easier. And so if there's something else we can do, please don't hesitate to reach out. And there's our contact information there on this last slide. All right, well, thank you. Have a good rest of the afternoon.
Thanks, Kathy. Thanks, Jenny.
Thank you. Bye.